Welcome to Help Yourself to Help. I'm Agatha Thrash from Uchee Institute, a place where we try to help people take more responsibility for their own health. During this next half an hour, we'll be talking with you about some things having to do with the health and the diseases, some of the diseases, of the genital organs. So we hope you'll join us for this program.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
We can be constantly amazed at the way that God has provided for our needs to protect our health. It's a very firm doctrine of the Bible that God wants us to be in health and that He has made every provision for that. Just take such things as the air that we breathe and the temperature of the air, the sun that comes so freely to us, and the plants that are everywhere. And many of these have foods that they produce that are ours free for the taking, like many of the berries and a lot of the nuts. And I'd like to talk with you about some of these foods now and just what they do. I have a review here of some of the plants that are used in epilepsy, in the treatment of epilepsy. In other countries of the world, they are a little bit advanced over us in this country in the treatment of epilepsy using plants. And here is one in the United Kingdom. Plants that are known for their anticonvulsant activity. Let me just read a small paragraph from this report that came out in the medical journal called Seizure in the year 2000. And it was in the month of September, if anyone wants to take a look at this article. Many plants are known for their anticonvulsant activity. Various phytochemicals. Now, a phytochemical is simply a nutrient or a chemical or sometimes a medicine that comes from a plant. Phyto means plant. So these are plant chemicals. And pharmacologic studies, phytochemical and pharmacologic studies have been carried out on these anticonvulsant plants. In fact, a review article was previously published with regard to plants with anticonvulsant activity. Thus, the aim of this particular group of researchers was to review all of this and to add the benefits of their research as well. Now, what they found was that people with epilepsy could be benefited by taking a diet high in those foods having an anticonvulsant activity. Well, that's very interesting and very helpful to know. It's very helpful for people who have epilepsy. We had one patient at Uchee Pines who, after he changed to simply a totally vegetarian diet, went for a whole year without a seizure, whereas he had been having about one seizure per week. Then he had another seizure, and it was discovered that he had eaten something that he was sensitive to that made him have another seizure. I wish I could say that all people with epilepsy would respond just as nicely. But we can't say that. Not all people will. And in fact, in the study that I was just telling you about, not all of the patients responded to the plant-based diet and those plants that are known to have anticonvulsant activity. Then here is some work on plants that have an antiviral effect. The elderberry plant grows in sort of marshy areas in many places of the United States, and these berries have an antiviral effect. So a person about to take a cold can take some of these berries, and it's a very great help to them. These same berries have an insulin-like effect, and so it's been found that people who have diabetes will respond nicely to the elderberries. Then here is a report about people having a reduction in cholesterol by having plants or plant foods that are high in the plant sterols. Sterols. Now that's a word that's very similar to some words with which we're familiar having to do with hormones like estrogen. The estrogen part is really a little takeoff on sterol or steroidal substances. Of course, we know that steroids come from the adrenal gland as well. And then the testes also produce testosterone, and the sterone part is a part of the sterols. So there are many plants that have sterols in them. Common plants like apples and tomatoes and cherries and beans, especially soybeans, and all the nuts and all the whole grains. They all have the plant sterols, and they have a very protective effect for us against the overproduction of such hormones as testosterone and estrogens in the human body. So these plants protect us against the overstimulatory effect of some of these. And then, of course, certain vegetable proteins and certain fibers help to lower the blood cholesterol. Very interesting things having to do with plants and their specific effects, effects that were there from the very beginning of the life of these plants when the Lord made them back before the Garden of Eden, when He made them in the first week of creation. At that time, He put these chemicals in there, these phytochemicals in these plants, so that they could be a great help to us. Now here is a report on Ginkgo biloba. This is a plant, comes from a tree, a leaf that comes from a tree, and the Ginkgo biloba has been used in the treatment of memory, and many reports will show that it's good for the memory. An occasional report will show that it had no effect on the memory, but I think we should pay attention to those great majority of reports that do show that Ginkgo biloba has a good effect on the memory. In fact, people that I have talked with recognize that it has helped them, and I look at it this way: if it's a placebo effect and it helps them, fine. The placebo effect is one thing that God has given us. It's not something that we generate ourselves, and so if it helps us by placebo effect, I'm very happy with that. If it's a help, it's a help. But this one showed that ringing in the ears, in 4 of the 5 reports that are summarized here in this article, they showed that ringing in the ears was helped by Ginkgo biloba. Sometimes people will not use a great enough quantity to make it helpful. But if we use enough and not too much, then we can be helped by the Ginkgo biloba. Now, we know that there are certain plant chemicals that can help various of our genital organs, such as the breasts, the ovaries, the prostate, the uterus, and those organs that have to do with reproduction. And I have asked Dr. Wynne Horsley, who is one of my colleagues at Uchee Pines, if he would assist me in talking some about these things having to do with women's disorders like fibroids and menopause. What would you like to tell us about that will be helpful to our listeners about these problems?
Well, you've already given a number of the foods that I even had on my list here regarding that. This is quite an interesting topic, and I believe even the approach at Uchee Pines has changed in the past years. Now, what one could say is that these phytosterols that are acting as a gentle hormone, in the case of menopause, you're getting a gentle female hormone effect, so that when the hormones from the ovaries, for instance, have basically shut down, then you're still getting a little bit of gentle hormonal stimulation. And so it's clear there why the person would feel better. There would not be an abrupt change in the hormonal pattern, not so abrupt a change. But here's another situation. A woman who has fibroids in the uterus which are definitely affected by the level of female hormones in the blood, or for that matter, breast cancer, which often, they nowadays check the sensitivity even to estrogens and progesterone. Many of them are sensitive to those levels. Well, one used to think that then those foods that have those phytosterols, we should avoid them completely.
Yes,
because
that was our thought in the beginning.
That's right.
Yes.
And then it became clear gradually that in fact, if you have those phytosterols, they block the heavy stimulation that occurs from one's own
very strong
hormones.
Strong reacting ones.
And so you get a tremendous benefit by having those. It's quite the opposite to what one might have thought originally.
And while we can say that the strength of the stimulus of these native hormones is strong, the plant sterols are also effective, and they can affect us in a way that we can alter the menopausal syndrome symptoms.
I remember reading about a case that perhaps you, someone at Uchee Pines did in Nutrition for Vegetarians with an older woman where it actually brought about hormonal effect in her.
Yes, that was Dr. Kelvin Thrash who did that experiment. The woman came with some problem. I don't remember what her basic problem was, but he thought she also had not had a menstrual period for 4 years. And so he was wondering if it would be possible to reduce the plant sterols in her diet and induce her to have a little bleeding of menstrual type, because the thing that causes the monthly bleeding is a fall in the female hormones. So he thought, he reasoned if he could remove all the plant sterols, maybe she would have a little bleeding. So he did just that. I remember the struggle that we had to eliminate all the foods that had plant sterols in them. So
they're so abundant.
They're so abundant in so many foods, so many plant foods, and still not go to, we didn't want to go to a meat-based diet for her and milk-based diet. So we fashioned a diet for her, and we had a cutoff day. And sure enough, 4 days later, she had a tiny little menstrual bleeding.
Interesting.
She was a very good guinea pig for that. Yeah, that was our first try on that.
I wanted to mention there are some that actually are quite concentrated in the amount of phytosterols that there are. In this little list that I made just a couple of days ago, it had some of the fruits that you mentioned, apples, cherries, and then other foods, olives, and so on. But the one that in the list of foods that had the highest, the largest number of milligrams per, say, 100 grams was, if you set aside ones that are just very rare, bizarre things like chestnut oil and so on, that kind of thing. The one that really was at the top, I would say, is sesames and sesame oil, which is a large constituent of sesames seeds. So that was one, was sesame seeds. I don't think most people use sesame oil alone directly, but if you use tahini, which is a very popular product, a large percentage of tahini is the oil.
That's sesame butter.
That's sesame butter. So in that, you are getting possibly the most concentrated form of the phytosterols of all the more common foods.
So since our postulate is that taking these phytosterols will protect you against prostate cancer or breast cancer, then it would be good for us to encourage people to take these foods.
I think so.
I agree. And besides that, they're good foods.
Oh, they are.
They taste good.
I have one objection for myself about tahini butter. I can't help but think that my reaction to tahini, the sesame butter, where I get pimples in my nose and so on, that either that particular oil has an awfully much stronger effect than other oils on me, or there actually is enough of those phytosterols to be producing like an adolescent reaction.
Acne type
That's right.
reaction. That's interesting.
A second one down among very common foods, in fact, perhaps right up at the top of common foods in the world, although we don't eat so much rice, the Orientals eat tremendous amounts, and rice bran is very high in phytosterols.
You know, that reminds me that certainly in the Orient, you will find rice and sesame seed in a preparation. And almost every table in the Orient will be, in the restaurants at least, and in the private homes where I have visited, they have these little sesame seed mills that you just hold it over your food, sort of like a pepper mill, and grind out the sesame seed at whatever. You can put them out whole, dispense them whole, or you can put them out ground, and you just do that over your rice or do that over your stir fries, and you get sesame seed there.
You know, looking at this just in the last few days has made me rethink this issue of Japanese women. You've heard about this, that apparently in the Japanese language there's not even a word for menopause, and that they have so little of any particular change at that, what we call change of life, and you know, dramatic thing, all kinds of magazine articles about it. I and I think many people have attributed that to their use of tofu, of soy products, and there's no question that that has some effect. But I think that there's more than just soy that's part of that, because of their use of sesame and of rice.
Yes. So. Well, certainly rice is an excellent food, too. It has a good quality protein. Doesn't have a lot. I think about 2.5 or 3 or maybe 4 grams per 100 grams of rice. But the quality is so good that if you get almost any other kind of food in your diet, you're going to get a good quality protein with rice in the diet. Now, you were telling me a little earlier that concerning the prostate, there are some exercises that a man can do that can help with the prostate.
Yes, I think we should call on Don Miller to give us a little demonstration of some of the things. Prostate congestion really probably is a big problem. Maybe it's a background. I'm not sure that enough research has been done on this. One thing that has been noted and commented on, a missionary doctor to India, Paul Brand, a neurosurgeon, noted that domestic dogs have often quite a bit of prostate trouble and apparently difficulty with urination, whereas when you look at wild dogs, no trouble at all. Well, the thing about domestic animals, we of course require them to not dirty the floor, whereas an animal out in the wild goes when it wants, which makes one think we should be a little more quick in responding to those urges. Yes. So if we used the muscles down in the pelvic region, contraction and then relaxation of those to help with blood flow, we may be helping those pelvic organs quite a lot. And so there are some very simple exercises that have been designed specifically for this. And I wonder, Don
Miller, come right over here and let's see what exercises these are.
I have the outline of a few of them. One of them is on all fours, going down on all fours. Then one alternately lifts one leg first, like this, and then lets it down. Now, when a person does this, raise the right one now, Don, you're using the buttock muscles to extend the hip, to get the leg to go out straight. Let it down. Okay, alternating like that, back and forth, is working those muscles around the pelvic rim. In our book here, it actually talks about if a person's having difficulty with urination, having a tap running, just that somehow it has an effect in helping the person when they finish a few times of doing this, they'll have an easier urination.
You know, as I am watching this, I think that women could benefit from this as well, to strengthen the pelvic muscles and to encourage circulation there so that they would have less painful menstruation.
Good, Don. Now the next one is a simple enough looking thing, but I don't think it's easy for balance. Why don't you stand and show us this one? You grab me if you need to. In this one, you lift one leg and you do some swings or circles with the foot and the whole leg on the one side. Now this requires quite a bit of exertion in these proximal hip muscles. I think you're doing worse with me holding you. Okay. And done for several minutes just before urinating. This can help with the urination just afterwards. Mm-hmm. One other one is a curious one. The person sits down on the floor, and then he's going to lift off the floor so the buttocks are completely clear of the floor, and then he goes over to one side. He's letting the right buttock touch and then the left, and going from side to side like this. And that pressure down on the pelvic region, on the buttocks, can make a difference in terms of fluid flow and getting that whole region to have the circulation going more easily. All of these may be a help with this issue of congestion in pelvic organs. So thank you very much.
Mm-hmm. Yes. Well, I appreciate that. And certainly in today's society, where we have men who do not exercise a lot, they are likely to get congestion in the pelvis, and I can see how these exercises would massage the prostate and strengthen the muscles there, so that the muscles can assist in urination. And urination problems are a big symptom.
Oh, they're, you know, I don't want to say 100%, but I would guess it's 80% or more of men at some point, mm-hmm. as they get to and past 60, mm-hmm. it becomes an issue. Mm-hmm. Perhaps we should say something about some more of the phytochemicals with respect to prostate enlargement.
Very good. I wish we would, because men need to understand that we are not powerless against disease. There are many things that God has given to us, even in this very sinful world, that can be helpful. So what would you like to tell us?
Well, you know, there are drugs that are used mm-hmm. for this. Unfortunately, the drugs, as is almost always the case, the drugs will have side effects. And since these are drugs affecting an organ that's closely connected with reproduction, you know, there's going to be hormonal side effects and side effects in connection with urination and so on. They're really undesirable, and often there might even be other ones like high blood pressure. Well, many people have already heard about one of these plant products, and here I don't think we need to talk about phytochemicals. The whole herb is well known. It's saw palmetto. Mm-hmm.
Saw palmetto grew in near my hometown in Baxley, Georgia, where I grew up.
The word, I think, came from Spanish originally. Palmito
Yes.
Means a little palm tree.
Little palm. It is a little palm. It grows from about this high to as high as my head and a little over.
I've never seen the plant. I'd like to see it sometime.
It has a beautiful flower, and then
right?
the berries form, and they're not very nice tasting berries.
And I think it is the berries that are used.
That's right. But the heart of the palm, which is right down near the root, is delicious.
Oh,
high protein,
okay.
and it also is high in plant sterols.
Saw palmetto would be a first one to mention for this difficulty in urination. By the way, the symptom that we're talking about with prostate enlargement is difficulty initiating that stream of urination. That's perhaps the most prominent symptom, often called hesitancy. Mm-hmm. And then, if that gets strong enough, it can really be, if that is bad enough, it can be difficult to get urine coming at all, mm-hmm. and they might have to put in a catheter. Other problems can follow that. You get the urine building up and urinary infection and so on. There's a number of other symptoms. Well, we should mention another plant that really does help with this. I believe this one's from Africa. It's pygium. I've heard some people pronounce it pygium. Pygium, if we want to give a dose, I have one here of 50 milligrams twice a day.
You buy that as a pill or a capsule?
I've seen it usually in capsules. Mm-hmm. I don't know what others think, but I'm not happy with telling people to use whole capsules because of the fact that 90% or more of them are made from animal gelatin.
So that hasn't been clarified as to its safety.
Yes.
So it's a little bit
if a
iffy now.
If a person can just tolerate dumping the contents of the capsule out into something and then taking it. There are others that have been shown to be of some help. I know of nettles. Nettles do help, and so those kind of things are often sold in a mixture for men's health. I have here a rather long list of various herbal and other products that are put together for prostate hypertrophy problems. There's even an amino acid that is said to give some help.
You know, if all else fails, does a man sometimes have to get an operation for the prostate?
Well, at times it may be necessary, and I certainly wouldn't say that it's never needed.
There might be some complications of surgery. What are those?
Well, one of the big ones is that in trying to shave out, carve out from the inside, when you do what's called a transurethral resection, you can come too near one of the sphincters muscles that hold the urine, and therefore a person can have incontinence. And so, of course, that's a very bothersome
and then sometimes marital relations can be difficult after, or impossible after, certain types of prostate surgery. I don't know whether the one that does the pairing or the reaming out, I don't know whether that one is associated with.
I think probably the most would be with the abdominal, or even the one that is the ones that where they do an open approach through skin, where they may easily transect one of the nerves to the reproductive organs.
Well, we have just a couple of seconds left. Do you have anything special that you would like to, more that you would like to add?
I am just so impressed by this whole topic of phytochemicals and the fact that God designed them, and that when we think we know all about foods, that shows how ignorant we are.
That's for sure, because I can remember very well when physicians everywhere were saying foods have nothing to do with cancer. They have no influence on cancer. Of course, no physician who has been trained in the last 20 years, perhaps, would ever say such a thing, because foods now, we are very well aware, have a lot to do with cancer. And with many other things, we can just take the list of phytochemicals and make a designed diet for people with various diseases. We can thank our loving Heavenly Father for that.